There's really three primary components of the national health reform agenda, and those are improving the access to care for Americans, improving the quality of care they receive, and improving the cost effectiveness of health care. And health information exchange plays an important role in all three of those. With respect to access to care, electronic medical records and the ability to exchange that data across health organizations will make it possible to perform activities like telehealth and telemedicine so that rural and underserved populations can get better access to health care from large providers in urban centers than they can today using modern internet technologies. With respect to the quality of health care, the critical difference that health information exchange provides is that it ensures that a patient's medical records follow them as they move from one healthcare provider to another automatically. Just as, for example, when you go from one ATM machine to another ATM machine, your financial records follow you from place to place. This will ensure that as you move from Dr. A to Dr. B, your medical records follow you. And that will mean that the doctor has access to information about your prior care, your medications and allergies, and other critical information that will enable them to provide better care to you at the point of care. And finally, with respect to the cost of care, because your doctors will have access to all of your previous tests and medical records, they can significantly cut down on the ordering of redundant tests and diagnostic imagery and other procedures through the use of existing materials. And all of those collectively will result in significant cost savings for the American healthcare population. Well, meaningful use is an important criteria for the subsidy of adoption of electronic health records by medical providers that's spelled out in the American Reinvestment and Recovery Act, or the President's Stimulus Package. And there's a specific section of that act called the High-Tech Act that specifies that providers, i.e. doctors and others, can receive reimbursements for the purchase of electronic medical record systems if they can demonstrate meaningful use of those systems. So health information exchange is important because some of the criteria associated with meaningful use that are being developed are around capabilities such as e-prescribing, or quality reporting, or other activities where information needs to go between one health organization and another. So for example, when prescriptions are issued, they typically go from a doctor's office to a pharmacy, which means health information about the patient and the doctor need to be transmitted from one organization to another. And similarly, activities such as quality reporting, which are critical to activities such as comparative effectiveness research and other activities that are taking place under the National Health Agenda, require health information to go from individual hospitals or doctors' offices to large national or state level quality organizations. And in all of those cases, health information exchange will play a critical role to make sure that information is exchanged securely and interoperably across organizations. What we've observed today is that the healthcare marketplace is very diverse. Most health organizations have very different systems from each other. And so there's a need for a common set of technologies to link all of these different these systems together in a common way using a common platform. And we really see service-oriented architecture as the basis for that. Because it can use the public internet, organizations could take advantage of networking technologies and infrastructure they already have to exchange health information. More importantly, service-oriented architecture can be highly extensible to meet new and future needs, and that's very important in a domain like healthcare, where really we are just beginning to understand the needs and requirements associated with health information exchange for organizations as we go forward. And so having a platform that can be extended to address those future needs will be critical to its success in the longer term. From the perspective of wounded warriors, they often struggle from complex, difficult to diagnose, and difficult to treat disorders like post-traumatic stress disorder and traumatic brain injury. And they often receive care both in government facilities such as military hospitals or VA hospitals, but also in private sector settings like community clinics. And so it's imperative that their doctors have a full picture of the care they're receiving in all of these environments so they can deliver and receive the best possible care. With respect to population health and pandemic disease response, it's very important for public health agencies such as the Centers for Disease Control, the Department of Homeland Security, and others who play a role here at both the state and federal level to have access to as much data as rapidly as possible when disease outbreaks are occurring, such as swine flu or other potential pandemic threats. And so health information exchange makes it possible for agencies to receive information from their counterparts at other states or from local hospitals so they can get a better picture of the emerging threat more rapidly. With respect to clinical research, health information exchange is critical to make sure that the activities of clinical researchers in domains such as cancer or wellness or public health can take advantage of the activity that is taking place with respect to routine clinical care so they have access to more data, and then in turn to ensure that clinical research breakthroughs and information associated with them are transmitted as guidance to practitioners as quickly as possible using health information exchange. And finally, with respect to disability benefits, today the disability benefit application process for many agencies is complex and time-consuming because it's paper-based. Health information exchange will make it possible for applicants to transmit medical evidence of their disability claims electronically much faster and in a much more computable form to agencies charged with making disability benefit determinations so that those benefits can be delivered more quickly to those who need them. What we've observed through Vangent's work with state organizations is that they're really struggling with budgets associated with delivery of Medicaid services and supporting the needs of their underserved populations. So health information exchange is going to be critical as a tool for them to get a better handle on where care is being delivered, where there are opportunities to realize efficiencies in care delivery and reduce redundant tests and things associated with that, and also to identify discrepancies in care, where some populations in the state may receive better care or have better access to care than other populations do. Having access to a large set of clinical data about care that's delivered throughout the state will enable states to make better decisions about how to administer their healthcare dollars.